to Money Talk Viewpoint. I'm Chantel Leeson. The most successful businesses have one thing in common. They know how to connect to the right people with the right message at the right time. And that's what we do at Money Talk Viewpoint. We connect you through our talk shows and podcasts. So our guests today are Jonathan and Katie Pfisterer, and they're going to talk to us about Medicare and its impact on your life and your well-being. Katie and Jonathan, how are you?
Good.
Great, Chantel. Thanks for having us.
Thank you for being here. I'm going to shift my view and I'm going to ask you a little bit about what you do, and I want you to share with the audience why it's important to have Medicare and how it benefits them. Anything before I get started here that you want to ask me?
I don't think so.
Okay. All right. Well, tell me but then just in case there's someone out there that doesn't know the difference, what is Medicare? What is it exactly? And how does it differ from this other stuff that's out there?
So Medicare is a federal program. It's for health insurance, and it is for individuals that are either over 65, or if they're disabled after a period of time, or if they have a chronic condition such as end-stage renal disease or Lou Gehrig's disease. But there's also people that are eligible that if their spouse has met those requirements and they're 65 and over, even if they've never worked. So there is an option out there too for that as well.
Yeah, that's good to hear. That's important because if the spouse is 65 and let me clarify this in my own mind.
Mm-hmm.
Who needs to be 65 years old?
Anybody going on to Medicare,
okay,
unless they're disabled or they have one of those chronic conditions. So even if it's a spouse that's never worked and they turn 65 and they want to know if they're eligible, if their spouse has met those requirements because they've put in their time, then yes.
At least one spouse must be 65 to be eligible and can cover the other spouse.
As long as the other spouse is also 65. If they're under 65, they have not met that eligibility yet.
You know what? I thank you for clarifying that. That's very important. Because there are a lot of May-December marriages where one person is much older than the other person, the other spouse. And they're over 65, but the other spouse could be 40. That's not uncommon. So the 40-year-old would not be covered. That 40-year-old would have to be 65 to qualify for Medicare.
Correct. So some people choose to work longer so they can use their group health insurance to cover their family, or they get their own private insurance.
Okay, well, I probably went into the next question I was going to ask, and that's who's eligible for Medicare. We're stepping right into that. I'll let you go talk us into that.
Right. So the people that are eligible, just like with Social Security, you put in your time. So there's that 40 quarters. You turn 65, or if you've gone into disability or have one of those end-stage chronic conditions. Once your birthday's rolling around, let's say you're 65, which is the most common, you can start getting enrolled up to 3 months before your birthday. You have up to 3 months after. The big thing is you want to make sure that you do it within your time frame. If you're working, you decide you're going to work longer, that's fine too. You want to do it within that 2-month period before or after you're going to stop your group health insurance through your work. Because if you don't, there are penalties and they don't go away. And by penalties, I mean that you're going to have a certain amount that you have to pay back to the government for that time that you were not insured.
Okay, let's go back. I'm gonna clarify something here. You mentioned over 65 and 40 quarters. Now, for some people out there, they may not understand what that means.
Okay.
Particularly if you were a spouse and you were the caregiver for the family, for the children, and you stayed at home. So cover that. So if you're the wife, I'm gonna use the traditional example. You're the wife. You stayed at home, raised the kids, and then you went to work when the oldest kid went to high school. And that may not explain how that works and what is the 40 quarters for that person.
So quarters are in a year. So you think every 3 months, there's 4 quarters in a year. So to meet those 40 quarters, you'd have to work for 10 full years.
Okay, that clarifies that point. So if the wife went to work when the oldest kid went to high school, that if she worked for 10 years, then she too would qualify for Medicare.
On her own.
On her own. That's important. But again, she would have to be 65. Am I correct?
Yes.
Okay. And you also mentioned something about certain diseases, Lou Gehrig disease and renal disease. Tell us about that, because listen, we have an aging population. They are more predisposed to different illnesses. If they are under 65, do they qualify for it?
Yes, these are two chronic illnesses that are covered under Medicare versus other disabilities may also have illnesses involved. But for end-stage renal, so your kidney failure or Lou Gehrig's disease, those are immediate qualifiers versus some of the other ones, you do have a period of time you have to be disabled before.
Now, what's the difference?
That's usually a 2-year period there, and you're usually working through disability through the states, and there's a lot of paperwork there that you have to go back and forth with.
Well, let me ask a question here then, Jonathan. Maybe either one of you answer this one. Now, what's the difference in Medicare and Medicaid? Because I thought that a person, if you had an illness and really hadn't worked, that you would go to the government for Medicaid. Now, explain the differences in the two for those who are paying attention to this and don't understand it.
Go ahead, Katie.
Okay, so Medicaid is a state program, where Medicare is a federal program. So for someone to qualify for Medicaid, it is state by state. They have their own rules, and it is based on income. So someone could be eligible for both if they have a lower income and they also qualify for Medicare. But just because someone goes onto Medicare because they're 65 doesn't mean they qualify for Medicaid. Same thing with disability. So it's going to depend on your income.
Oh, so, okay, point of clarification here. So Medicaid is based on income. Medicare is not based on income?
Correct. So there is no ceiling. You can make as much money as you want and still be eligible for Medicare. And that is based on those similar things to Social Security. You're meeting that 65 requirement. You've met your hours of work. Medicaid could be for any age, and that's based on your income.
Okay, and Medicaid covers any illness. Is that right?
Medicaid isn't based on illnesses. That's just based on income. So that's to get assistance from the state for your health insurance.
Okay. That's confusing, but you know what? I will say one thing. If people need help, they need to come to see you. Am I correct?
Right. We can walk them through the process either way.
I think that's the biggest important factor is that you can go online and pretend you know what you're doing. Let's say it just like that. You don't always, you think you know, because there's no one to talk to in many cases. You really do need to talk to a professional. That's why we're talking to you, to help someone understand that part of their life. You need to make sure that's done right. Well, let's talk about when should someone enroll and how is that handled?
So we take it by an individual basis, sitting down with them, going over their wants, their needs. So if they have group and health insurance at the time, that might be a great option for them, even if they've turned 65 and they're still working. Sometimes the coverage or the cost of that insurance is going to be less than Medicare. However, with age, sometimes you're required by certain companies you may work for to move over to Medicare. So you have to check with your specific company. But then we look and see, okay, maybe Medicare covers actually your prescription drugs better than your group health plan. So it is literally individually based. We have to look at the whole picture based on what you're paying for premiums, your income, and also your prescriptions.
You know what? Let me go back and understand this real quickly. So actually, when you are working, the company's medical insurance benefit package will tell you need to go over to Medicare, or how do you know to do that? Do they come and tap on your door and say, hey, you need to get off of our package and go to Medicare?
Sometimes. And sometimes they'll just be flat out honest with you that their plan just isn't as good.
Okay. Get off our plan, what they say.
Yeah, they're bringing their group rates higher by being so much older. So it is case by case scenario.
I think you mentioned a point too, because see, there are a lot of older workers in the workplace now, and for numerous reasons. One, we're living so much longer that people just don't want to spend the next 35 years sitting at home, working in the garden. They want to keep themselves active for as long as possible. So some companies are allowing that. I've got a client of mine who just got a new job. He's 77 years old. So with the government. So they really are, people are still, and it's not because they have to, it's because sometimes they don't want to be at home. Some people just don't want to sit around the house for 40 hours a week.
We find that people retire more than once after 65 for that very reason.
Is that right?
Or they stay retired for 6 months. Now they're stir crazy from sitting at home. They want to get out of the house. And from our experience, we see a lot of more people going back to work just on a part-time basis or as a 1099 basis or what have you for that reason. It's not for the health insurance. It's for the peace of mind.
You know, I found that even jobs that people think aren't glamorous, like I found people working at stores like Target.
The Home Depot's another big one where they're on their feet, they're walking around and they're talking to people, and that to them is a great day.
You know what? I'm glad you brought that up because I've heard people say, "Oh, and the guy was old and he was still working at Walmart," but they forget that guy's probably living by himself. The kids have left the area. There's no one there, and going to work is what keeps him emotionally and physically happy and healthy.
Right. Well, everyone's situation's different, right? There's no simple answer for anything.
Not everybody wants to be down on the beach in Florida. I mean, of course, with the weather now, who wants to be down there?
Well, there's that for sure.
Absolutely. But getting back to, I lost my train of thought. We were talking about people working for corporations. So if they're working for like any Fortune 5, or it doesn't have to be a Fortune 500, it could be any corporation. And they're particularly for the smaller companies. If you're on a smaller company, they really don't want you on their medical payroll because if you're on the medical benefits, if you have any illness, it raises am I right? Does it raise their rates if you have?
It could. Yeah, that's the thing with group rate, right? So it's the average of all those people. So, and then sometimes there's a pension retirement package that has Medicare and tied to it as well. So when they do retire, they're like, oh yeah, we have a union or we have a pension or whatever, and that takes care of the retirement benefit as well. Same thing. Is that the right choice? Maybe it is, maybe it isn't. And it's just really dependent on how good or bad that program is versus the state. We come across it where it is and where it isn't, or it's almost. So
one of the things I wanted to add in there is there's sometimes confusion where people think they have to have Medicare at the same time, and they don't. There's no point in double paying. So you don't need to pay for your group health insurance at work and pay for Medicare. However, Part A, they've been paying into that their whole life. At the bottom of your check where you see those deductions, they've been paying into that. So you could just take Part A if you would like, and that becomes your secondary insurance.
So what would be the secondary insurance, your Medicare or your group insurance?
So your group health would be primary, and then they would bill Medicare as a secondary if you chose to take just your Part A.
Well, let me ask a question about that. What's the benefit of that? Does your group insurance pay better benefits, or is there something they don't cover? Or here, I leave it to put in your hands there. Give us some feedback on that.
You're right, both of those things.
Okay.
So they could have better benefits. That's why you're still keeping your group health insurance versus totally going over to Medicare. Or there's a portion of it that's not covered. And so normally you would get a bill for that amount. However, if you have your Part A going at that time, they would then go on to bill Medicare, and then you would only be responsible for that portion that Medicare didn't cover after.
Seems to be mostly used when the group insurance has a massively huge deductible for their hospital expenditures, and where your Part A's deductible for hospitals like $1,600, give or take, changes every year. So there's a right time and a right place for it, but and if you're going to the regular doctor for a checkup, it doesn't really pertain to you at that point.
So let me go back and ask that question one more time then. I think I got it, but I'm not clear exactly. So if you had both Medicare and your group benefit package, if you hit a medical expense, let's say you have to have some kind of surgery, and your deductible is going to be a couple of $1,000, you can use the Medicare to cover that?
Well, so surgery is considered Part B, not Part A, right? Okay. So Part A, you get some blood, you get the hospice care and the hospital, and each one of those has a co-insurance or a deductible before you have to meet it first. So like I said, more times than not, it doesn't really do much for you in our experience. Someone else's could be different, but generally speaking, your primary insurance is going to be your savior when it comes to that, unless you have like a $10,000 deductible.
Oh, okay. Yes. Okay. Yes. Right. Exactly. You mentioned hospice. I'm hopping all over the place now.
I know we're jumping.
Well, you know what? I think that the audience wants to hear that, though.
That's lay it on us.
Go ahead.
No, yeah, you get a question about hospice or
Tell me about that. How does what does that cover? Is that something? Is that in-home care or out-home care, or what does that cover exactly? What is that?
So end stage, right? Your end of life care and how that is. And usually that's done in a facility. And there's a lifetime allotment of days. Now, granted, when you're in hospice, that's usually not a 2-year adventure for you. It's usually 6 months or less, it's my understanding. So, and then there's also thresholds for co-insurance and co-pays and deductibles when it comes to that by itself without any kind of gap coverage. This hospice is not long-term care. That is completely different.
Oh, okay. Okay, very important to know that. And and I want to cover long-term. I'm going to go through couple of questions first, but then I want to go over that one pack.
Sure, we'll circle back, no problem. Yeah.
Because that's with an aging population, people need to prepare themselves. We're not going to be sexy and gorgeous all of our lives. We're not going to look like the Kardashians.
Despite our best efforts, yes.
Right. So we have to prepare for that phase when we're not as agile and not as able to get around as well. Let me go back to some basic questions here, though. When does somebody qualify to enroll, I should say?
So in enrollment process, our general practice is 60 days before you're going to be going on a Medicare, whether you're retiring or not. That is when you want to get on the ball and go to the ssa.gov website, create your Social Security account if you haven't done that already. That's a whole nother thing that we probably haven't talked about, but anybody who's paid into the Social Security system should go to ssa.gov, create their account so someone else doesn't do it for them and try to turn on their benefits and things like that. We know identity theft has been rampant. So this is just one way to help thwart that away. But 60 days is what we recommend to start the whole process, even though you're eligible 90 days before the first of the month of your birthday for Medicare specifically. Okay. And then 3 months after your birthday.
I'm going to go back. You brought up something. We're like firecrackers here, but you brought up something. You brought up identity theft. Now, believe it or not, that's a huge, huge issue. Can somebody actually go back and steal someone's identity and take their Medicare benefits from them?
Well, I don't know about that per se, but I know that people have turned on their disability or they've put in claims for Social Security and then they show where to send the check. And now other people are getting these dollar benefits unbeknownst to the actual person whose account's been stolen or hacked. So that's why it's important for you to generate your Social Security login and have your, two verification, your cell phone or email, whatever, and have it gone that way. I mean, most people don't know their identity's been stolen. Tax time right around the corner for us here. People are filing taxes on their behalf and saying that they owe all this money back, and the government catches it and say, "Oh, actually, we overpaid you." And people, I didn't even file my taxes yet. What do you mean? You paid me more money? It's a really big thing to be conscious of. Like you said, it's all over in our senior market. They are heavy targeters when it comes to those scams.
If I can jump in, something you said was about Medicare benefits.
Yeah.
Something that I've seen, and it's a common practice, is that people will call seniors and they will pretend like they're just checking on their coverage for them and ask for their Medicare number to verify benefits. No one should be calling and asking for a Medicare number. Because what they're doing is getting that information so they can flip a plan to some other plan so they get paid out on it. So that's something to be wary of, because usually once they do it, the plan goes into effect before they realize it or their agent realizes it.
And generally it's a wrong plan. It's not as bad for the person, but they don't know.
Wow. You really have to be on top of your game for a lot of things that you take for granted. We've changed as a society. We just have to be aware.
And we always say, if somebody calls you regarding Medicare, your insurance, you hang up the phone and call us right back, and we'll let you know if that's the actual carrier reaching out for you for a home wellness check, or if it's some scam artist trying to steal business and or put you on the wrong plan, things of that sort.
I'm glad you brought that. Actually, I think myself personally, I've learned not to respond to anything anymore.
Yeah. Give it to me in the mail and then I'll look at it. Period.
They said the best thing to do is go to the website itself and check. But don't respond to things. I do that now because I have, I went through identity theft, another story altogether, but it's a nightmare. It's a nightmare. Sometimes they can stay in your stuff for a very long period.
Sure.
But I do recommend that you go to the website, don't respond to anything on the email. I get all kind of stuff. I'm not going to tell you my age, 'cause I'd like to lie about my age. But
That's right, because we're staying young and sexy, as you said.
forever. Look out, Kardashians. Anyway, how much does Medicare cost? How much will it cost for the average person?
Well, that's a can of worms right there, right? So how much your Medicare costs you determines on what your income was 2 years ago. Your modified adjusted gross income. And that's a very common situation, because a number of people who are finally retiring and going on Medicare, that first year they're on Medicare is usually not the same amount of money they were making 2 years ago, right? And so, but the government doesn't look at it that way. But generally speaking, for your average American, you have two different channels here where it talks about dollars, your Medicare A and your B. There's a cost there. No matter what you do, you will always have your Medicare A and your B. And your B is what costs you money. A, you paid for your whole life. B, and depending on how much money you made, will put you in different buckets and brackets within your monthly expenditures for your Part B. What we normally see for a normal 65-year-old who the two husband wife and they made under $150,000 2 years ago, they're going to spend anywhere between around 160 just for their Part B, and then maybe up to $150 for their gap and drug plan. But that just depends, because there's over 100 different carriers that offer different prices for the exact same thing. So, and that's just one route. Another route could be $0 extra a month outside their Part B. So it's what's the right thing for them.
Let me ask a question here, because I think I paid more than what you just told us.
Yeah, Irma, it's the government trying to get their money from you.
Thank you for opening my eyes. Let's say that you did make a substantial amount of money, and when you apply for Medicare, but you've been on it for a while, how do you get that reduced?
Great question. So instead of waiting for the government 2 years after the fact, you sold your business or whatever, and 2 years later, now you're just on Social Security or a pension or whatever, and you're within the average bracket, it'll automatically take care of itself. At some point, Medicare will let you know, oh, your new bill is this. But realistically, what we advise to our clients is, even if it's 1 year later, send in an appeal form, and you're going to have a life-changing event where you're not working anymore. You're retired and your income is different depending on what your threshold is. Fill out a form and you send it back into Social Security and you cross your fingers and hopefully they grant it. We found 50-50. Sometimes they make you wait that 2 years until your taxes reflect it. Sometimes not. And it's just who's behind the curtain filling out the form. But your income is drastically different from 2 years ago. I would recommend anybody fill out that appeal form or give us a call. We can help with that too.
Okay, I'm going to ask a really far out question. I'm going to call it the Harlan Saunders Kentucky Fried Chicken question. Because here's my question. Person retires and they didn't make a lot of money. They made an average income during their working years. So they get Medicare and Social Security. All of a sudden they build a business and it's firecrackers and they start making a ton of money. Does the government increase your Medicare and along with your Social Security at that point, or what happens at that point?
So if you're already pulling out of your Social Security at that point, that's a whole other question in itself. Generally speaking, your full retirement age reflects when you were born and how much money you can make on top of Social Security before having to pay any of it back, depending on your age and what that threshold is. So with that said, they can increase your Part B and your Part D, Irma, if you made more money down the road. Correct. They can do that. If you didn't turn on your Social Security, you could technically increase your Social Security payment up to age 70 and a half when that's where the cap and the ceiling is. Because the way that it's calculated is how much money you paid into it with some earnings. There's a whole equation there. And that's why part of our seminar that we teach people is see what Social Security has recorded for you over the last 10 years, or your highest grossing 10 years, to make sure that it's accurate.
You know what? You're very, very informative. I think I'm hoping that I know that a lot of people are going to respond to this, because this is something that is a complicated issue for a lot of people. It looks cut and dry, but it's not. Let me go to my next question before we go off track. But I want to know what does it not cover? What does it cover? And what does it not cover for Medicare?
The old not coverage. And so Medicare, and this is traditional Medicare A and B, which is what mom and dad had for the longest time. It doesn't cover vision, dental, hearing, right? Stuff that we've grown accustomed to while we're working. It doesn't cover, well, we know it does not cover long-term care. We talked about that as well. And there's a handful of other things that it specific. Oh, plastic surgery. That's right. Non-needed plastic surgery. So you got to go across the border to get some cheap plastic surgery if that's what you want to do. And there's a few other things I think I'm missing, Katie, from what Medicare doesn't cover.
So typically things that you might have had with your group health insurance, like the dental, vision, hearing, transportation, and then over-the-counter items, which are also available depending on what plan that you go with. So Advantage plans, that's one of the options that John had mentioned. Those will give you benefits sometimes to get things like you would normally need for colds, Band-Aids, maybe even for stuff getting in and out of the shower if you're having some problems with mobility. And then some of the plans even give you money for groceries. So
Wow.
it just depends on the different options that what interests you.
So all these boob jobs and jobs I see for people that are done, and I know they're a little older, that's not covered by their, what does that cover? That's not covered by their insurance?
So if, let's just say somebody had skin cancer and they took out some of their face, that plastic surgery to repair that would be covered.
Okay.
Because I want a facelift and some Botox, that's not covered. Just like acupuncture is not covered either. Care outside the United States is generally not covered. And routine foot care is not covered. So there's a number of different medical things that are not covered on traditional A and B.
Routine foot care, really?
That's what,
Wow.
that's what they say. Now, once again, you have a medically necessary, like if you're a diabetic and you have wound care, that's different. So once again, everyone's situation is slightly different. So it's really great to, talk to your broker or call us. We can let you know specifically when you get into the weeds. Because every year Medicare sends out 100-some page book to you that you're supposed to learn and read and update yourself with.
Oh, yes, we love doing that. I'm glad you have your telephone number in the background there because they say they need to contact you. So
Right there.
Exactly. This is one of my last questions. I'm going to talk to you guys half a day about them stop. But what additional healthcare coverage can you get when you're under Medicare?
Well, so just like most plans, even under 65 and you're not on health insurance, you can get individual vision, dental, hearing, things like that. You can also get long-term care plans, which is really important, right? So all the things that we just talked about that aren't covered, there's a way for you to get additional coverage outside. And I don't know, about you, but I'm a big fan of not paying more money out of my pocket than I have to. So even if you do have $2, $5, $10, $100 million, would you rather use your money or the insurance carrier's money? Chances are the insurance carrier is the way to go. You get more bang for your dollar.
Yes, I agree. I think even those who have a lot of money, that's why they have a lot of money.
That's right.
Listen, we've covered a lot of material here. I think I've covered everything I had planned to ask you. Anything else you could bring up that would be helpful?
I mean,
hospital indemnity.
Yeah. So one of the big, statistically, I've seen in some readings that this advantage. So you have your traditional Medicare, and then you have your new route, which is that Advantage plans. When you see a famous football star on TV telling you to get stuff that's $0 and things like that. But what they do, along with group insurance, is there's gaps, right? So there's plans out there that you can get to cover these gaps out of your Advantage plans, your hospital stays, outpatient surgery, things like that, stuff that's really super affordable. So like I said, you're going to hedge. But the other thing about it is most people, when they're going on a Medicare for the first time, they probably didn't get long-term care insurance. Maybe they did. Probably they didn't. And just like life insurance, the older we get, the more expensive it's going to be, right? So, and what's going to happen to us? Do we want to go to a facility? Do we want to go home? A lot of our clients rather stay home and have their health care done and brought to them, but they don't want their kids to be bothered and quit their job, because that's the other thing. Families are now double family working units. So who's going to come home and take care of mom and dad? Who's going to come take care of me and my wife or whomever? There's other plans out there that you can actually get to help cover those costs too, through indemnity plans or home health care plans. Things are super cost friendly that's going to provide you service for a shorter period of time.
Wow.
And that's what I would do if I don't have long-term care insurance. And even if I did this other supplemental in addition to, because some long-term care insurance companies, they also have a gap period. You got to wait 90 days. You got to wait 6 months before it even kicks on. So what are you going to do for the first, those many days?
Wow.
And so that's some of the expertise that we provide within those realms.
That's the reality of life, and that's the hard part. Aging is the hardest part because you have to prepare for it. Unlike when you're a kid starting off life, when you're aging, you got to prepare for that, and you got to prepare that who may or may not be there for you. I think we covered everything. You know what? I'm going to thank you so much for spending time with me and sharing with my audience about Medicare. I'm going to ask you to come back in the future for other subjects.
Chantal, I think it'd be our pleasure, and thanks for having us. It was a really great experience for us.
I'm glad you have your numbers in the background for those who are paying attention to the background. And I'm going to let it go at this. And thank you so much for being with us today.
Thank you.
Thank you.